Hello, everyone, and thank you for being here today. My name is Jennifer Warino, and I'm excited to share this training focused on an issue that deeply affects all of us in healthcare: staff burnout and turnover. This isn't just a staffing problem, it's a system wide challenge that affects patient care, employee satisfaction, and organizational performance. My goal is to help us understand the scope of the problem and walk away with real, evidence based solutions that we can start applying immediately. On the agenda, we will first take a look at what staff burnout is and how it relates to turnover. We will discuss why these issues matter and how they affect an organization, as well as the societal impact of these issues. After discussing the issues, we will turn to evidence-based solutions to reduce burnout, thus reducing turnover. We will discuss how you, as a manager, can act and make a real difference. I always like to look at real-world examples that highlight the possibility of success, so we will do that today. Then we will wrap up what we have learned and talk about building a healthier workplace together. The training will end with questions and/or suggestions and any thoughts that come to mind. In developing this training, I came across this quote from A.J. Darkholme from Rise of the Morning Star. I found the quote especially fitting for this training. To work in healthcare makes all of us torchbearers. We all carry a heavy responsibility, but that does not mean our arms do not grow weary. We should never overestimate the strength of anyone's arms, even our own. Growing weary is becoming burned out. So let's talk about what staff burnout means. Burnout is a state of chronic physical and emotional exhaustion, depersonalization, and a sense of low personal accomplishment that leads to decreased effectiveness at work. Burnout is usually caused by increasing workloads, inadequate support, lack of control and autonomy, a stressful work environment, and the impacts of being unable to meet patient needs and demands. In healthcare, it's intensified by long hours, emotional strain, and understaffing. When people feel like their efforts aren't recognized or supported, it leads to disengagement, job dissatisfaction, absenteeism, and ultimately turnover. Although we will discuss methods to reduce burnout, you must remember that burnout is cyclical. Let's take a look at the burnout cycle. Starting at the top, an employee can be completely satisfied in their position, feeling optimistic and energetic. Once the onset of stress begins, the employee may begin to have some anxiety, along with having lower productivity. This leads us to chronic stress, which includes social withdrawal and chronic fatigue. Then burnout occurs. Along with the previous symptoms, burnout includes behavioral changes and an obsession with problems. Habitual burnout leads to deep unhappiness. This is where we see depression, physical and emotional fatigue, and possibly dangerous levels of chronic sadness. Our aim is to keep all employees in the job satisfaction phase. You may be asking yourself, how does burnout relate to turnover? Well, first, let's define turnover. Employee turnover refers to the total number of employees who leave a company over a specific period, voluntary or involuntary. Good employees leave for several reasons, but burnout and boredom are two of the most common reasons. Burned out employees are 3 times more likely to report actively looking for another job than those who are not burned out. Replacing an employee can cost 1 to 2 times the salary of the departing employee. Beyond the financial costs Constant staff changes can disrupt teamwork, disrupt continuity of care, and morale. So, understanding burnout is the first step in stopping the cycle. Burnout does not happen in a vacuum. Internally, it leads to high costs from constant recruiting, lower care quality, loss of valuable employees, low staff morale and employee engagement, and potential malpractice suits and subsequent litigation. That's a direct hit to performance and patient outcomes. Employees who experience burnout are more likely to check out mentally, leading to reduced employee engagement. These employees are 16% less likely to go above and beyond what is expected of them at work. There are also some societal effects to employee burnout. Externally, the effects are just as concerning. When providers burn out, patients wait longer for care, often from unfamiliar and rotating staff. This impairs the quality of care. In underserved communities, this can widen already existing care gaps. And on a societal level, persistent burnout can lead to medical errors, affect patient satisfaction, and undermine trust in the healthcare system. This is why it's not just a workplace issue. It's a systemic public health issue. This quote speaks for itself. Burnout is preventable with the right systems in place. Let's talk about the right systems. There is no one-size-fits-all approach to alleviating burnout. But the good news is we are not powerless. There are research-backed strategies that truly work. The first one is wellness and resilience programs. They have been shown to reduce burnout by helping staff manage stress and build emotional stamina. Next, we have flexible scheduling. This allows for a better work-life balance, especially for caregivers or night shift employees. Rewards and recognition programs like shout-outs, awards, or even a simple thank you can help boost morale. Training managers in emotional intelligence helps them respond to employees with empathy and understanding. And finally, safe staffing ratios ensure workloads are reasonable, which reduces fatigue and mistakes. These strategies can and do make a difference when applied consistently. Now let's talk about how you as a manager can make a difference. Poor management and negative work culture contribute to 56% of workplace burnout. So, as healthcare managers, we play a critical role in making a difference. Not having a say in how you do your job or being unaware of your job responsibilities can lead to burnout. So first, we need to ask questions and listen to our teams. Open and regular communication with your clinical teams about how they are doing, what they need, which can include conversations about schedules, assignments, or workload, and what is expected of them should be offered. Dr. Jason Mitchell, the Chief Medical and Clinical Transformation Officer at Presbyterian Healthcare Services in New Mexico, found that when you share traumatic experiences with the people around you and you are not isolated, it's easier to move through it. Building connections and friendships between your team members can help employees feel like they have a supportive community at work. In the healthcare industry, many employees are surrounded by loss, fear, and sometimes isolation. We need to acknowledge these emotions and make mental health conversations normal. A significant part of preventing burnout is assuring your team that they do not have to carry their trauma or work stress alone. Allow space for self-care. Self-care refers to nourishing our emotional, mental, physical, and spiritual well-being through various activities and practices. You need to give your employees opportunities to practice self care at work, and those opportunities need to be personalized and meaningful to each employee. Lastly, use human resource data to track turnover and absence trends, as well as employee feedback. This will help us catch early warning signs of burnout. Again, there is no one size fits all fix. Our departments, like our patients, have unique needs, and responsive leadership is key to creating a sustainable, supportive workplace. Let me share a quick success story. NYC Health Plus Hospitals was recently recognized by the American Medical Association for their efforts to enhance physician well-being and reduce burnout. The organization introduced two key initiatives. First, they implemented the Helping Healers Heal program, which offers emotional support to healthcare providers experiencing workplace stress or anxiety. They also partner with the American Foundation for Suicide Prevention to introduce the Interactive Screening Program, which is an online tool that connects staff to peer and clinical support before a crisis emerges. In addition, NYC Health Plus hospitals revised their policy to remove invasive mental health questions from physician credentialing applications to reduce stigma and encourage seeking help. From 2021 to 2023, NYC Health Plus hospitals found that employees had a significant decrease in overall stress, compassion fatigue, anxiety, and feelings of sadness. Within that period, persistent burnout symptoms decreased by 22%, and the organization has achieved a significant reduction in turnover rates following the implementation of the initiatives aimed at reducing burnout. So, what can we do going forward? First, we must acknowledge burnout as a real and valid issue. Second, we need to consistently apply what works: wellness programs, flexible scheduling, leadership training, and support systems. Third, evaluate your progress. What's working? What's not working? And finally, build a culture that supports and empowers everyone, from new hires to seasoned professionals. A healthy team leads to healthier patients, better care, and a stronger organization. Let's commit to being part of the solution together. Now, I want you to think about what strategies you've seen in your own units or departments to help reduce burnout. Also, think about what obstacles you are facing when it comes to supporting staff. Use what works and correct what doesn't. Burnout solutions don't happen in isolation. They happen when we talk openly and work together. So let's take a few minutes to reflect and collaborate. I want to thank you all for your time and attention today. Burnout and turnover are complex challenges, but with the right tools and united approach, we can create a work environment where people thrive, not just survive. If you have any follow-up questions or want to talk more about specific strategies for your department, feel free to reach out to me. Let's continue the conversation. Thank you.